Hello everyone, my name is Dr. Anirudh Rao Deshmukh. I am a consultant neurologist in Aster Prime Hospital, Ameerpet, Hyderabad. Today we are going to talk about epilepsy. Epilepsy, more commonly known as seizures or fits, is a form of brain disorder where there is hyperactivation of brain cells due to more electrical activity, which leads to uncontrollable and unconscious jerking of muscles of the body. This leads to a very noticeable, which is called as fits. So coming to symptoms of epilepsy, apart from the very well-known fits type of seizures where a patient falls down on the floor and has typical jerky movements of all four limbs with frothing from the mouth, we have other minor seizures which are like complex partial seizures, which is basically just blank staring without any response with some automatic movements of hand and feet which are repetitive, but at the same time the patient is unresponsive. Absent seizures, which is basically just blank staring without any awareness of the surroundings. Some focal seizures where patient is conscious but only one hand or one leg is jerking uncontrollably. So these are some minor forms of seizures apart from the typical fits we know. Apart from this typical seizure activity and atypical seizure activity, in some patients there are some aura premonitory symptoms which give a warning sign to the patient that the fits are going to come. So some patients have headache, some patients have a feeling of fear, they can smell something burning, they can see some flashing of lights or a feeling of doom. These are some kind of aura or pre-seizure activity which alerts the patient sometimes in some situations that they are going to have a seizure. Coming to the tests of epilepsy, which is basically to recognize the cause. So for this we first do imaging, that is MRI or CT scan, to look for what are the cause of seizures. This imaging can detect brain tumors, infections or some shrinking of brain or some congenital defects in the brain which cause this abnormal electrical activity in the brain. Then we do EEG, which is basically electroencephalogram, where we record the brain activity through electrical cords and see which part of the brain is hyperactive. We also see which part of the brain is hyperactive and how the epilepsy is spreading so that we can do proper treatment. So when it comes to treatment of epilepsy, the most important point is if you ever see a patient having fits or falling onto the ground with frothing of mouth, the first and foremost thing we should do is turn the patient to one side so that he does not swallow his own saliva. Then next, we shift the patient to the hospital where we start anti-epileptic drugs, which is basically drugs which suppress the electrical activity of the brain and stops the seizures. So first we give those injections to stop the ongoing seizures. The second part of the treatment is to prevent further seizures and find out the cause. So to prevent further seizures, we continue certain medications, initially injections and then tablet when we discharge the patient. At the same time, we try to treat the underlying cause so that the seizure frequency or recurrence can be reduced.